Now, routinely, medical oncologists, cancer treating physicians are talking about how to integrate genomics and germline genetic testing, whether it's single gene, panel gene, Lynch syndrome, large panel, into patient care, into their workflow. Maybe you correct me here, but how many different recommendations for cancer types is genetic germline testing recommended for?
Almost 10 different papers have come out of this. One of them came out of JAM Oncology that was the high level, which reiterated what we have discussed before in breast cancer, but across all those cancer types, which is a universal approach is vastly more effective at identifying all those individuals who have underlying genetic risk for cancer. The evidence is becoming irrefutable. It is catalyzing a calling for universal testing, universal
Yes,
germline
yes.
genetic testing for all patients with any cancer type for the purposes of getting those patients on the right therapies. With those kind of calls going out, there are a number of sites that are actively implementing that. All patients with cancer should ask their physicians for germline genetic testing. If their physician hesitates or dismisses it as unnecessary, keep asking. This can open opportunities for cutting-edge effective treatments that will not be accessible to you otherwise, whether FDA-approved therapies or in the context of clinical trials. And as we get better at treating cancer, this is also crucial to identify genetic cancer risks so that patients who successfully beat cancer do not go on to develop a new preventable cancer.
This is Genetics for Healthcare, a podcast for patients.